So let's get you nice and loose. Take a nice breath in and relax. Let's let that loose. Very nice, very nice. Hello Baltimore, it's Dr. Jeff Kalstein with Kalstein Chiropractic, your Baltimore area chiropractor. And I'm with Alayshia this morning. And what is unique about this young lady is, where do you live?
I live in Upper Marlboro.
Upper Marlboro, yeah. So how long did it take you to get from Upper Marlboro to Towson on a good day?
On a good day, an hour.
An hour, okay, all right. And so you first came, I've got the history right here, you first came in like 2020.
Yeah.
And what brought you in then?
TMJ.
TMJ, yeah. And did we have good results with that?
Yeah. So if I wouldn't have done this, I went to the dentist. They gave me a mouth guard, they wanted to give me Botox, they wanted to do all these things.
Right.
And at the time, my situation was getting progressively worse, and I don't need Botox. So,
yeah. And she came about 6 or so times, and during that time we did what to help you? We did...
I started off with the adjustments,
right.
And then that was an instant thing, and then I received acupuncture.
So what you received was trigger point dry needling. We're not acupuncturists, but as chiropractors we can use dry needling to help solve some of the soft tissue issues with a lot of musculoskeletal injuries. And then did we do any soft tissue? Did we do any soft tissues with the muscles around there with our fingers?
Yeah.
Yeah, so we were doing some dry needling, we were doing some soft tissue. So basically what we did was we improved how your jaw was moving, right? And then you came back one other time, and a couple times, 4 times in 21, and I don't remember what that was for, but...
my TMJ was active.
So
so that second time is when you started with the dry needling.
The dry needling, yeah. So what brings you back this time?
Oh, just tore up in a different way. My back, my upper back.
Your upper back, okay, all right. So had you tried anything for the upper back prior to coming here?
No.
You just came straight here. Okay, all right, great. So let's have you face the camera. Go ahead and turn your head. No, you can just look at Carly. Turn your head to the left. Does that bother you at all? No, and turn to the right, all the way as far as you can go. Does that bother you at all? And now bend, look up at the ceiling, bend backwards. Does that bother you? And now bring your chin to your chest. Does that bother you?
No, but I can feel that it's very tight.
Up in here and through here?
All the way down there.
Yeah,
it's like,
okay, all right.
Like 2 belts.
Yeah, so Alayshia came in on, was it on Tuesday? Yeah, so one more thing. Let's have you bend side to side for me. I want to see how you move down there. Yeah, see, that's really good. Now go back the other way. Okay, and go back to the right one more time. And back to the left one more time. Okay, let's have you lie on your left side down and face the mirror that way for me.
Can I say something?
Yes, ma'am.
So when I do this,
yeah,
all that hurts right up in there.
Yeah.
But when I do this, it doesn't feel as bad.
Yeah, that's why we're taking that side first, because there's a limitation in how you move. That's how we decide what we want to adjust first, no pun intended. So go ahead and lie with your left side down and face the mirror. And lean back in. So what's the significance of those shorts?
At the time when I bought them, probably about 7 years ago, they were on sale.
But you have Star Wars shirt on, and it looks like a SpongeBob pair of shorts to me, whoever SpongeBob is.
Yeah. No.
And I don't know. I don't know who SpongeBob is. Let me have this on.
Okay, I'm not gonna judge. I am gonna judge. How do you say words and don't know?
SpongeBob?
Yeah.
Well, I think that my grandchildren talk about SpongeBob, I think. So let's get you nice and loose. Take a nice breath in and relax. Let's let that loose. Very nice, very nice. Go on the other side. Is that comfortable?
Yeah, I needed to let that sit in for a second. Okay, that's really good.
So the treatment is an adjustment, but we also did some dry needling up on that upper back, didn't we? Come on over here for me. Like this. So just relax. I'm going to roll you towards me a little bit, okay? Let that loose for me. Beautiful. We should have put a mic on that. That was awesome. On your back for me.
It was awesome.
So now we're going to adjust our hips. ahead and slide back up that way for me.
I was told previously that they're uneven. I don't know how true that is. But
Yeah, I think there are people who have, slide up again, so this one's a little bit more stuck than the other one. So what I want you to do is I want you to hike up your hip towards your shoulder, lift it up towards your shoulder. Nope, like this. Draw it up this way, like that, okay? Now draw. There you go, just like that, hold that tension. And relax, just let it loose. I'm just gonna give you a little tension on it.
Okay.
Nope, let go. Now draw it up. There you go, beautiful.
you know what? This feels like I'm holding a fart that I don't have.
Yeah, now go like this. Let it go. Would you relax it? Now let it go. There it goes. So that's a little proprio facilitation to get that to move a little bit. So lift your head up for me, please. And you can slide and put your head at the top of the table.
Okay.
Not so far. Right like that. There you go. She has mid back pain, and yesterday, see, that's not as tight as it was the other day, but it's still tight. Drop this shoulder. That's beautiful. That's comfortable, isn't it?
Yeah. Interesting.
Yeah. Good, step off and go ahead and face one more time. Now let me see you turn your head to the left as far as you can go and to the right as far as you can go. Yeah. It's beautiful. Go the other way. Oh, it's really good. Now bring your chin to your chest. Has that changed out at all?
Yeah, there's no more tension.
No more tension, yeah. So we're going to go out into the hallway, and I'm going to use that technique that I did the other day where I push down in here, right? Yeah, so let's go ahead and do that again. We won't go the hallway. On your tummy. Do you work out? No?
My idea of working out, I walk a lot.
You walk a lot. It's probably one of the best activities you can do. And go ahead and slide up for me a little bit. All the way up. Yeah, now relax your arms down. I think when we talk to people, young people, they're not quite there for the most part, but we talk about living better longer, right? And there's different components to that. One of those is movement. And the way we take movement, we divide it into two categories: cardiovascular fitness and strength training. So you're never too young to start on a program like that. And walking can be an introduction into the cardiovascular fitness, especially if you walk for 45 minutes or so. See, this area, what we're doing is we're walking up her spine in each segment at a time, and I'm looking for those areas that are not moving properly, and there it is right there. That's stuck, if you will. So take a deep breath in, breathe all the way out, let it loose. Okay. Was that uncomfortable?
No.
No, that's standable now. I'll do one more thing. Let me see you bring your chin to your chest for me again. How's that now feel compared to when you first checked it?
Much better.
Much better.
Even the last time, I felt some weird pain at the center. I don't feel that.
Feel it right now? Yeah, okay. Okay, so what we're going to do now is we're going to go dry needle, and we actually put class 4 laser on there, which I think is really a powerful tool for this kind of condition. Okay, so anything else you want to share with everybody out there?
Get it together.
Yeah, good. Thank you, Baltimore. Carly, if they like this, what do they do?
Subscribe.
Subscribe. And if you're having any pain between your shoulder blades, give us a call at 410-296-7700.
There you go.
How am I doing with that, Carly?
Getting better.
Better. Thank you, Baltimore.